Hello all, I wanted to talk to you about kidney stones. Everyone's favorite. They're very, very uncomfortable, causes a lot of discomfort and distress, but we're here to talk about how we can help out with that. First off, I wanted to describe to you the normal anatomy. As you can see here, we have our kidney, that's what makes the urine, and then there's a ureter tube where that urine that's created by the kidney drains down through the ureter tube, and then that urine then is stored inside your bladder. Once it's stored inside your bladder, then you urinate that out when it's time to urinate. But I want to talk to you about what happens though when we have a stone. As you can see here in this picture, you'll see the stone that's in the mid part of that drainage tube, that mid ureter there, called the obstruction, that's your stone. And what happens is that urine that's made by the kidney, it's trying to go from the kidney down the ureter tube and into the bladder. But when you have that obstruction there, you can see that there's a buildup of backed up urine, and then it causes the kidney to swell. That's what the discomfort from a stone is. It's not the stone bouncing around, it's that back pressure that's created from the obstruction. Now say this stone is trying to move or migrates a little bit, some of that obstruction may go away, and then the urine is able to drain back down into the bladder, and then you don't hurt. Then it could get obstructed again, and then all of a sudden hurt again. That's why you have this inconsistent discomfort. But there's many different ways that we can break up the stone. And one of them is, if it's large enough, we go through the back. But if it's a normal size one that's in the ureter, I just wanted to show you the main option of us going through with the camera. What we would do is put you to sleep. There's no cuts or incisions made, and it's an outpatient procedure. I then put a small specialized camera, as you can see. It drives through the pee channel, through the bladder, up to the ureter, and then you're able to evaluate the stone there. And then that's busted up with a little laser fiber from there. Once the stone is busted up, then we do have to put something called a stent in. A stent is a necessary device that helps the healing process afterward. As you can see, the stent, it's about the thickness of a coffee straw, and what it does, we place it in the kidney, curls in the kidney, and it transverses through the ureter tube and then into the bladder. That's designed to help with the healing process. So once that stent is in place, it's completely internalized. And it's not permanent, it's something that remains in there temporarily. There are two different ways that we get that stent out afterward. That'll all be determined at the time of the surgery, and we'll go over that during the procedure or after the procedure. Either you take it on your own, there'll be a string at the end of it where you just simply pull it out. It's very well tolerated. Some people are a little anxious about that, but it takes less than 2 seconds to do. Or if the stent needs to stay in a little bit longer, we will take it out for you. And again, we'll go into great detail on how that works. While you do have the stent in place, some people it doesn't cause discomfort. Sometimes it can make it to where people have some discomfort with urination or some side pain, some frequency and urgency. But regardless, it is a necessary evil if it does cause those side effects. But this is a way that I wanted to describe how we can help you when you have a stone. We're trying to, like I said, prevent that discomfort from happening, and we're also trying to prevent infection and kidney disease.